These practices are designed for people following total knee replacement surgery. You will need a chair, the wall. If at any point you find that you're having pain or have a hard time breathing deeply and calmly, consider backing away from the exercise and maybe even taking a break at any point throughout the practice. Have a wonderful practice. So come standing with your back against the wall. And we'll go back to Tadasana. So go ahead and bring your shoulders and your head and your hips to touch the wall. Point your feet straight ahead and put an imaginary block between your thighs. And then from this position, go ahead and raise your arms up overhead. Yeah. Rotate your palms to face each other and even press your thumbs to the wall. If it's hard for you to bring your hands together, just separate your hands and straighten your elbows. Breathe. You could stay here, or with your thumbs, press your thumbs into the wall to move your body away from the wall so you can test your balance a little bit. Good. Keep your feet pointing straight ahead. Keep squeezing the imaginary block between your thighs. And then slowly lower your arms down. And then take a wide stance with your back still touching the wall. So separate your feet wide, and you're going to turn your right toes out to the side so the pinky edge of your foot is parallel with the wall. And you're going to turn your left toes in slightly. And you can use your hands on the wall for balance, and then start to bend your front knee and make sure you can still see your big toe. So in this pose, the knee will want to drop in and cover up the big toe, so keep pressing your knee towards the wall. And you can stay here, or you can bring your arms up parallel to the ground, palms down, thumbs facing out, and breathe. Your back leg is straight, your front knee is bent, and you can come in and out of this pose by bending and straightening your front knee if you like, or you can stay in the pose with your knee bent. Keep breathing. Then go ahead and release your arms down. Turn your feet straight ahead again. And walk your feet in towards each other. Just take a break. A few breaths here. And then come back into the wide stance again, and we'll do it on the other side. So wide stance. Maybe a little bit wider than you just did, if that's possible. And then turn your left toes out so the pinky edge of your left foot is parallel with the wall. Turn your back toes in slightly. And then start to bend your front knee, but make sure you can still see your left big toe. So try to bend your knee in line with your second toe. Keep your back knee straight. This side might be completely different. If your balance feels okay, you can raise your arms up parallel to the ground and breathe. Use the wall for balance. You can stay here or start to bend and straighten your front knee, moving in and out of the pose. So just the front knee bends and straightens, the back leg stays steady and strong. And then slowly release your arms down. And straighten your front knee, come out of the pose. And we'll do that again. This time we're going to keep the front leg straight. So go ahead and take a wide stance again. And turn your right toes out. And turn your left toes in slightly. Try to align your knee with your second toe. And this time keep your right leg straight, your front leg straight. Both legs are straight here. Great. And then lift your arms up. Now stay here or start to bow forward over your front leg. And you can bring your front arm, your right arm alongside your right leg to your shin, your thigh. You can lean into the wall. Good. Rotate your top palm towards the direction your back foot is facing. So turn your palm open and breathe. Keep both legs straight and strong. Even draw them towards each other. Keep your legs strong, and then slowly come out of the pose with your upper body first. Once you're upright, go ahead and release back out of the pose. Take your time. The wall is there. And then we'll go to the other side. So take a wide stance. And turn your left toes out. Turn your right toes in. Both legs straight and strong. Check in with your left foot. Make sure that the pinky edge is parallel with the long edge of your mat. And both legs are straight. And then arms can go up, like we just did. And then start to bow over your front leg, keeping both legs straight. Keep breathing. Go as far as feels comfortable for you. Rotate your top palm open. This side might be completely different, so listen to your body. You can alternate between bending and straightening your knee. That's perfect. And then slowly come on out. Bring your feet back together. Take your time. Use the wall. The next one we're going to do is come into a chair position. So walk your feet forward. And then bring your hips to the wall. So just your butt touches the wall. And then lift your arms up towards the ceiling, palms facing each other. Good. And then slide your hips down the wall. So make sure you can still see your big toes. That's going to keep your ankle and your knee in alignment versus your knee going beyond your ankle. Keep your feet parallel. And again, imagine you had a block you were holding between your thighs. And breathe. To make this a little bit more challenging, you can lean forward and take your shoulders away from the wall. So just your hips touch the wall. Breathe. And then slowly straighten your legs. Come on out. Great. And release from the position. And then grab your chair and place it on the mat close to the wall. And then move the chair a little closer to the wall. You're going to face the wall. Bring your hands to the wall. And then you're going to bring your foot back to the low rung on the chair. And if this feels easy, you can always move the chair further back or bring your foot up to the seat of the chair. We're going for a stretch in the front of the bent knee. You can stay holding onto the wall, or you can reach one arm or both arms away from the wall. Check in with your balance. Use the wall as you need. Keep breathing. Keep your bottom leg, standing leg straight and strong. You can adjust your back foot either further back on the chair to get more of a stretch. And then slowly release. And try it on the other side. So this is a version of baby dancer. So you're going to bring your foot to the chair, either low or high. You may get a cramp on the back of your leg when doing this, so just find a position that is comfortable. Start with your hands on the wall. Keep reaching up to the top of your head. Keep breathing. Stay here or lift one arm or both arms up towards the ceiling. Try to keep your bent knee pointing straight down towards the ground. It will want to drift out to the side. So again, imagine there was a block you were holding between your knees. And breathe. And then slowly bring your hands to the wall. Gently remove your foot from the chair. And just stand for a few breaths here, noticing how your body's feeling. And then make your way to sit on the chair for our final relaxation. Take a seat. Make sure your feet are on the ground comfortably. Your back is supported. Place your hands either palms up or palms down on your thighs. Close your eyes and start to notice your body. While you're in this seated position, we're going to work on a body awareness practice. Close your eyes and feel the bottom of your feet, the back of your thighs, and your back resting against the surfaces that they touch. Start by bringing attention to your right sit bone. Then bring the attention to the back of the right thigh, the back of your right knee, the back of your right lower leg, your right heel, the bottom of your right foot, the top of your right foot, the front of your right ankle, the front of your right lower leg, the front of your knee, the top of your right thigh, the top of your right pelvis. Notice your whole right leg. Now bring the attention to your left sit bone, the back of your left thigh, the back of your left knee, the back of your left lower leg, your left heel, bottom of your left foot, top of your left foot, front of your left ankle, front of your left shin, front of your left knee, top of your left thigh, top of your left pelvis. Notice your whole left leg. Now let's bring the attention to both sides, both sit bones, back of both thighs, behind both knees, back of both lower legs, both heels, bottoms of both feet, tops of both feet, front of both ankles, front of both lower legs, front of both knees, top of both thighs, top of both pelvis. Deepen your breath and notice both of your legs, from your feet to your ankles, to your knees, to your hips, to your pelvis. You're welcome to stay in this relaxed position for as long as it's comfortable for you. Whenever you're ready, you're welcome to move out into this position and move into the rest of your day. Namaste.